This is a lecture that I gave in March 2013 in Cambridge, and it concerns atherosclerosis. Atherosclerosis is the leading cause of worldwide mortality. It caused almost 18 million deaths in 2005, and notice on the graph on the right hand side the number of deaths compared to the number of deaths caused by cancer. This is a timeline of how atherosclerosis develops throughout life. On the left hand side we have a normal looking artery. Increasingly over time, as we move towards the right hand side of the slide, atherosclerosis develops initially as intimal thickening, fatty streaks, intermediate lesion, and then complicated atherosclerotic lesion. The disease tends to present sometime after the third or fourth decade onwards. This is an example of a normal coronary artery. You can see here a wide open lumen with a normal looking smooth coronary artery wall. This is a normal artery wall in a cartoon style diagram. We have a lumen here in the middle shown in green. The lumen is lined with endothelial cells. We then have an internal elastic lamina and a tunica media composed of smooth muscle cells, contractile vascular smooth muscle cells. The endothelial cells are very important in maintaining the integrity of the vasculature. They're antithrombotic, anti-inflammatory, and vasoprotective. This is an example of a mature atherosclerotic plaque. In fact, two plaques within this artery. We have one here at the bottom with a large lipid core and a fibrous cap, and then at the top of the artery again a fibrous cap and a lipid core. This is a diagram of the arterial supply of the heart, with the coronary arteries, the right coronary artery here and the left main coronary artery dividing into LAD and left circumflex arteries. If these arteries become involved with the disease of atherosclerosis, then this can be the end result. On the right hand side we have an example of a pathological specimen of an entire heart which has been sliced across. We see here an area of necrosis shown in dark in the anterior wall and septum and part of the lateral wall of the left ventricle. The right ventricle is shown here, and on the ECG here we see evidence of ST elevation in the anterior leads. In terms of what causes the disease of atherosclerosis, well, there are several what are known as risk factors. Some of them are non-modifiable and some of them are modifiable. The non-modifiable ones that we can't do anything about are things like family history, which of course reflects an individual person's genetic background, the age of the patient, which reflects the cumulative exposure to risk factors, and the gender is also very important in that men are far more prone to atherosclerosis than women. Women seem to be protected by the effect of estrogen, but by the age of 60 or so, women tend to catch up in their rate of atherosclerosis development. Modifiable risk factors are ones that are probably already known to you, things like hyperlipidemia, hypertension, smoking, diabetes, and obesity, and particularly important these days is leading a sedentary lifestyle and particularly psychological stress.